So welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society. This is produced by HCPLive and hosted by Skin of Color people, I guess leaders, kind of like Tasneem and I. And we're going to delve in the latest research, clinical insights, culturally intelligent and responsive care practices in dermatology with this leading group of experts. I am so excited to be here with one of my most favorite people in the world, Tasneem Mohammad, who happens to be on the cover of the AAD abstract announcement today. So, Tasneem, hello, how are you today?
I'm wonderful, and thank you so much for having me on this podcast today.
Yeah, well, we're going to talk a little bit about pigmentation, but specifically vitiligo, and you are like a national global expert in that area. So just wanted to ask you a few questions, if that's okay.
Yeah, and I think it's been really great working together at Henry Ford, where we have a very robust vitiligo department, and we've been very supported kind of by our entire vitiligo community in addressing some of these very important issues.
Yep, absolutely. And also working with the Global Vitiligo Foundation. And also you edited their newsletter for a couple of years and helped them with their guidelines. Um, so we're going to kind of talk about some of the clinical nuances, treatment considerations, as well as patient experiences. So this name, you see a wide diversity of patients, but how would you say that vitiligo presents differently in patients of color?
Yeah, I think that's a great question because when we think of vitiligo, we think of depigmentation on the skin, but depigmentation in someone with light skin is very different than someone who has darker skin. And so what I notice most frequently is that with lighter skin individuals, oftentimes we're kind of going in the room, we have our Woods lamp to really help delineate all of the vitiligo areas. But with darker skin, you can see those areas very clearly. And maybe you need your Woods lamp to help differentiate between something that's hypopigmented or depigmented, maybe some areas where, it's harder to differentiate, but overall the contrast is much more stark in darker skinned individuals.
Yeah, and that has impacts because lighter skin individuals are affected by vitiligo, as we can tell. Our clinics are full of individuals of different skin types, especially when there's sun exposure, the contrast increases. But there are unique cultural challenges such as stigmatization, limitation of work, educational attainment, and the levels of depression and anxiety seem to be maybe a little different. Have you noticed that at all? The impact of vitiligo on skin color versus broader skin types?
Yeah, and as you mentioned that, I just was thinking of anecdotes for some patients that we've even seen together during my training, where, especially in certain communities, patients were coming in saying like, "Hey, doc, I need you to get rid of this vitiligo. I need you to do vitiligo surgery for me because I'm getting married in a couple weeks. And if my spouse's family knows that I have vitiligo, they're going to call the wedding off." And, I think these are challenges faced by many communities and many individuals where their vitiligo really impacts their ability to get married, ability to have jobs, and all these different opportunities. And like you mentioned, the mental health impact is incredible with, I think anecdotally in our experiences in clinic, we see it, but even in studies that have been done across many cultures, like the Valiant study, showing that there is a much higher burden of mental health conditions like anxiety and depression in these skin of color populations.
Yeah, the Valiant study is over 25% were actually on an antidepressant or some kind of medication for mental health. And I think almost 40-50% had seen some kind of counselor over the past year. And then in countries like India, the level of depression, anxiety as diagnosed on the PHQ-2 questionnaires approached 89%. So to your point, there's a significant impact. And in the US, it was still 50% at least, which is much higher in the general population. So obviously, this disease is much more than skin deep. What are the pitfalls that you've noticed when you're diagnosing vitiligo? Like, where can people get it right? Where can people get it wrong?
Yeah, and I think that the thing to remember with vitiligo, it's such a individualized disease where everyone has their own unique perspective. You can have a patient coming in with very extensive involvement who doesn't want treatment and feels like this is just part of my identity. I don't need treatment. And then on the flip side, you have someone with very just a tiny, small little patch on their skin and they're so distressed by it. So I think it's really important to, one, of course, we want to assess a person's degree of vitiligo, look for those signs of disease activity and rapidly progressing vitiligo, or, signs that, patients are going to have more recalcitrant disease, like, that acral fingertip involvement. But I think we also have to see the impact on the patient's quality of life in terms of, deciding how aggressive we need to be in treatment. And I think the one thing that really, really bothers me when patients come in, because of course we're at a tertiary care center, a lot of times our vitiligo patients have come through a couple providers. And sometimes they tell me, doc, I didn't get treatment for this for many years because I was told this was a cosmetic condition. And that made me feel bad that, like, why am I getting treatment for this if it's not even real? And then other people told me that there weren't any treatments for this. And so I think, just having the awareness of the fact that vitiligo is not a cosmetic disease, there are treatments that are available and that are being investigated to manage vitiligo. I think that's the main thing. And if you don't feel comfortable treating vitiligo, I think it's very valid to kind of refer that patient to someone who does feel comfortable. But I think that initial, discussion with patients to see where they're at with their vitiligo, how they want to manage their vitiligo, and then giving them that hope that there are things that can be done.
Well, that's such a powerful commentary on society as well as our specialty or the field of medicine, that people feel so guilty that it's cosmetic because society has judged it as cosmetic when it's not. And it's not cosmetic for a variety of reasons, but the mental health impact, the association with autoimmune comorbidities, the association with genetic predispositions, the impact on work, the ability to get a spouse and retain that. I think you and I remember that case where the patient had genital vitiligo. He was already married and his spouse let it slip, and then her family pushed for a divorce. We completely repigmented the patient with vitiligo surgery, but unfortunately they still got divorced. And even though we laid out all the data and the chances of passing on to children, it just didn't work out. But we also have patients who walk in who have a little depigmentation, hypopigmentation, more hypopigmentation in the cheek, and the parents are really worried that they have vitiligo. And then we walk in, and it's like, well, that's pityriasis alba. And we diminish it, but we don't really address the concern that it was vitiligo. Do you have vitiligo in your family? Have you seen it? What's bothering you? What else acts like that? What are other kind of diagnostic dilemmas, Tasneem, that you see that you have to worry about as far as a differential diagnosis for vitiligo?
Yeah, and I think you hit on one of the very common ones, especially in skin color populations, pityriasis alba, which presents as hypopigmented patches kind of on the facial areas. I think another one that we see commonly, especially that gets confused with more segmental vitiligo, is the nevus depigmentosus. I think other things that you should really think of, especially in someone where you're like, oh, are these early confetti-like lesions? Is this just a very early progressive vitiligo versus why are all these hypopigmented patches there? It would be a hypopigmented mycosis fungoides. I think that's a good one to remember. And then other things like PLC can sometimes present with hypopigmentation. But I think you'll get things in the clinical history, family history that will, and then, definitely your Woods lamp exam that will help differentiate. And I think in a lot of these cases where there is a concern for some of these other conditions, a biopsy may be helpful. Even though typically when we're thinking of vitiligo, we don't typically biopsy for management or for diagnosis in management.
Yeah. Two couple of pearls I learned about recently. So maybe you already know this, and you know the literature so well, but Dr. Youngmin Bai and his group in South Korea described this stamp test. So you have nevus depigmentosa, you fire a test spot of the excimer laser on the nevus depigmentosa, or what you think is segmental vitiligo. And if you have pigmentation 2 to 7 days afterwards, it's nevus depigmentosa because you do have some melanocytes there. But if nothing happens, it's probably vitiligo. Have you used that at all?
I haven't in our patient population, just because even scheduling for eczema or getting the insurance, all of that sometimes can be a little bit challenging. But I think that's a great idea and potentially, something that we could do even with outdoor exposure, handheld devices, and something that we could start integrating in clinics, just kind of figuring out the flow of that.
Yeah. The other thing is the distribution of vitiligo. So, vitiligo tends to be on the acral surfaces many times. It's segmental in the segmental variant versus IGH, idiopathic guttate hypomelanosis, is on the shins, tends not to involve those other locations. And then if you had to do a biopsy to rule out something like hypopigmented MF, do you have any specific strategies of how to handle those biopsies? Like, do you do a shave? Do you do a punch? Do you do multiple punches? What do you do for those?
Yeah, so it depends on the condition. I think if you're thinking of like a PLC, maybe a weird syphilis, something like that, I think a punch biopsy is fine. I think for mycosis fungoides, we've kind of gone towards doing more broad shaves. So you get a little bit more of that epidermal component. But I think in any case, it's always a good idea to talk to your pathologist to see kind of what they need to make the specific diagnosis, and then being very clear in your path tag to give a little bit of description so that way your pathologist knows exactly what they're looking for.
Ah, what a great example of how we will surpass artificial AI or chat GPT, because open evidence is not going to walk in there and know their pathologist,
Yeah.
know their patient, call them out and say, watch out for this differential. I'm not totally sure. And then kind of come to a consensus because chat GPT has to use a reference database. And if the experts like yourself don't agree, there has to be a conversation. So I'm really grateful that you know your pathologist and you know your patient to kind of reassure both sides. Um, Okay, so Tasneem, what are the unique things that you have to kind of factor in for treatments? You've kind of covered the diagnostic dilemmas, but are there unique things that you have to cover in all populations, but especially skin of color populations when it comes to caring for their vitiligo?
Yeah, I think I kind of touched on this a little bit earlier, but viewing your patient as kind of a not just like, hey, you have light spots on your skin, but in a more like holistic manner, taking the time to see what their experience with their vitiligo has been, kind of do a very thorough history and physical exam, and then talk to them about their goals for treatment. And I think also patient education is extremely important because I think, with certain communities, there are certain issues and certain, paradigms surrounding medical care. So I think on one hand, you have that patient I mentioned who expected full repigmentation in a week. And I think you have to really set the expectation of repigmentation is a slow process, or you have vitiligo in these areas, which are traditionally very difficult to repigment. So, this may take some time. And then on the other side, you have patient populations where there is a lot of medical mistrust for a very good reason. And when, many of our treatments for vitiligo are off-label, not FDA approved, you might get that discussion of like, hey, are you doing experiments on me? Like, why are you using this thing that's not approved for my condition? So I think having those conversations can go a long way in building trust with your patients, and also so that there is an understanding of why you're doing what you're doing, which I think patients really appreciate and make them much more comfortable with, the pace of treatment and what is being accomplished at their visits.
I think that customization is so important. Uh, I split my time between Henry Ford and Hamzavi dermatology and dermatology specialist. And I saw a patient in our rural clinics, about 87 years old, with extensive vitiligo on his scalp and his face, Caucasian individual, but he has a deep pigment. And he was so worried about how he would look in a casket if he passed away. So, just customizing it and just meeting people where they're at. But then also the distrust that occurs in many parts of our society, both in rural, urban, and all of America. I think meeting people where they're at will hopefully get us to a place where we can trust each other again. And I think that you do a very nice job. I've watched you do it so many times. So keep that up. And um, sometimes we think of vitiligo treatments as just the pathophysiology, topicals, which we'll cover quickly, and phototherapy and surgery. But add in the social component, support groups. So walk me through a paradigm. How do you use topicals? How do you use phototherapy? How do you use systemics? How do you support groups? How do you use surgery?
Yeah.
And do it in a minute. No, just a couple of minutes.
No, I'll give you the quick and dirty version.
Okay.
So I think it really depends on, again, how aggressive you want to be for a patient. A lot of times I'm using things in conjunction with one another. So I think the efficacy of many of our topicals is really enhanced by adding on phototherapy. So you have something that's going to modulate that inflammatory component, and then the phototherapy, while it's also immunomodulatory, it's going to help. It's going to help with repigmentation as well. So I really like using those two things together. I think there is a role for orals. We use, pulse steroids or oral minocycline to help with disease stabilization, in addition to oral antioxidants, which can be helpful for maybe someone who has recently had unstable disease, but is doing okay, or is just very nervous about developing instability. And then I think for our patients who are stable and have more localized areas, I think surgery can be a really great option in terms of inducing repigmentation. But I think in the context of all of those treatments, we also have to view our patients as people in the context of a larger community. And so one, I think just a quick assessment of vitiligo impact on quality of life, because I do think that if we can get patients plugged into resources with mental health, I think that can be really helpful for a lot of our patients. And then, sometimes patients aren't ready to take that step, or they don't necessarily need the services of a mental health provider. But I do think the support groups are a really great source of community for these patients to kind of talk about their unique experiences, to develop connection and community with people who may be going through similar situations and have that support. And so Dr. Rich Huggins, who we know very well and work with, he has done an amazing job with our V-Strong vitiligo support group, that has developed in conjunction with members of the vitiligo community, and they have worked really hard to help other groups kind of start up or develop. And I think that there is greater awareness of support groups as a really important part of the vitiligo community, and how we manage vitiligo, and things that are important to offer patients for really comprehensive care.
No, the support groups have been incredible. And Richard Huggins, to your point, has done a remarkable job. I also want to recognize Vicky Tehart, who was my first co-chair at the Global Vitiligo Foundation, did a great job from the great state of Kansas. Alicia, who is on our board at the Global Vitiligo Foundation, and then our national global leader, Stephen Taylor, along with people like Kim Boyd and so many people who have the condition, but also have created a space for people to kind of develop agency. And a lot of times people's mental health and sense of community improves when they are able to create that environment. We have a wonderful support group leader, Jared. I think he's from Florida. He was at Camp Victory this year that Pearl Grimes, our incredibly charismatic former president of the GVF, set up. And kids with vitiligo just were there, but the parents or the adults who had vitiligo themselves and had to have that struggle suddenly had a sense of agency, but also fulfillment, because they were able to help these children cope with the condition that they struggled with. And then we also have Lee Thomas in the Detroit area, who's done a remarkable job. But I think we are so lucky to have been witness to our patients treating our patients, and then our patients and individuals with vitiligo treating us, to make us realize that medicine isn't just about phototherapy or topicals or surgery. It's actually the stigmatization, and that comes through building community. So I'm really grateful that you highlighted that. What are a few takeaways you want to recommend, Tasneem? So people are watching this and they say, "Wow, I got to hear Dr. Tasneem Mohammad, who's on the cover of the AAD abstract announcement. You helped devise the guidelines for phototherapy. You helped do the newsletter for the Global Vitiligo Foundation. You have become a leading expert and advocate for this disease state." But not too many people can see Dr. Tasneem Mohammad as a physician, and you have so many colleagues across the entire specialty. Can you give them a quick takeaway that you'd recommend from the things that we've discussed in the past few minutes?
Yeah. So I think main takeaways are, patients are coming to you for help. Really take their concern seriously. take the time to listen to where they are at with their vitiligo, how they experience the disease. And then, I think topicals are a very easy place to start for all patients. And if you have the resources and the comfort level to, pursue more active management, then I think that's great. But if not, there are lots of referral centers and providers who do feel comfortable with treating vitiligo, especially in those more complicated or advanced cases. So I think, we're all very happy in the vitiligo community to take on some of these more difficult cases. And I think, remembering that vitiligo is not just skin deep, and asking patients about impact on quality of life, if they would benefit from, management of depression and anxiety that's potentially associated with their vitiligo. I think that's really great too. And then I think also resources are really important. So I think the Global Vitiligo Foundation has done a really great job with their website. That is an area for information for patients, also resources in terms of finding a support group that they can connect with. So I think that's good information to give to patients and even for providers to look at if they're trying to gain increased familiarity with vitiligo and kind of what's going on in the community.
Very good. And the one thing I would add, because I was your attending many, many years ago, so I'm always going to add a little bit, is it takes time. Vitiligo treatment takes time. And it's not atopic dermatitis. It's not psoriasis. The skin will repigment at 3 months, 6 months, a year. And then the psychosocial state lags the degree of repigmentation. Tasneem, I'm so grateful to people like you who care for all people and understand that skin of color patients may have some different requirements, and you embrace everybody who comes in your clinics, and you've done such a good job. And I'm also grateful that you put your career into caring for pigmentary disorders like vitiligo. I hope that the listeners of this meeting had an informative experience, and you got to hear Dr. Tasneem Mohammad speak about vitiligo. I also hope that you'll continue to be an ambassador for our specialty and our profession. Vitiligo patients, they need you, but they need you to embrace them for who they are. If they're coming from a skin of color population or from the broader population, you need to understand what they're going through, and just that awareness will help you connect with them. And sometimes therapy is more than skin deep. So thank you so much for listening. And Tasneem, I'm going to give you the last word. Anything you want to add before we finish up?
Yeah, I just wanted to say, thank you for all the nice things you said about me, but I'm also very fortunate to have such amazing mentors like yourself. And so I think it's really important for us as providers to really foster, interest in these areas in the next generation, and also really show that we do, as dermatologists, take care of patients from all backgrounds, all walks of life, and that caring is what we do, and we need to really foster this in the next generation of dermatologists as well. So thank you for all that you do, Dr. Hamzavi, for the community, and also thank you to HCPLive and the Skin of Color Society for hosting this podcast on these very important issues.
Well, check out HCPLive, visit the Skin of Color Society meetings, attend the Global Vitiligo Foundation, and become that clinician you always wanted to be. But only if you listen to HCPLive. Thank you.
Thank you.